This is a program that's been in the works for really 20 years. It's been discussed for a long time. When I was hired 5 years ago, that was really the plan, was to come in and put this program together. It's been in the works for such a long time because there's such a need in Tuscaloosa, especially West Alabama. Alabama's got one of the lowest rates of mental health providers in the country for population, and especially these rural areas in the western half. That's been a big concern for the state and for the university, is to provide mental health care. There's been primary care here for quite a while, one of the oldest programs in the country, but next to primary care, mental health care is probably the next most important type of care.
The only way to solve that problem sustainably is to have a program where we train our own psychiatrists in this college. Right now people are actually retiring, aging out, and if you don't have a training pipeline, then the community suffers as a result of that. So that's why the psychiatry training program is so important for the region.
Substance abuse is all over. Unfortunately, the area here in the rural Alabama seems to be particularly suffering under lack of services. The idea is to increase access to treatment and increase options for treatment.
That's why this program started, is to take care of that need, to train psychiatrists locally, to get familiar with the community, with the needs, and then graduate here and then take on one of the many openings here, not only in Tuscaloosa, but in West Alabama at large.
We've been approved for 6 residents per year for a total of 24 residents. We're expanding our space, we're expanding our faculty, we're expanding our specialty care into addiction medicine, forensic psychiatry, child, adult, and adolescent psychiatry.
This is an area that psychiatrists really need to develop, is collaboration with primary care. And I think this is going to be a really wonderful thing that we'll see in the future. Because we will only have family medicine and psychiatry in this campus, that's going to be a wonderful opportunity to be able to really develop that relationship strongly.
The call is going to be over at the main psychiatric emergency room, which is a special emergency room for psychiatry. It's North Harbor Hospital. As of now, the residents will not be working in-house call. There is a social worker that manages those cases, and they will call the resident, discuss the case, and then the resident can then decide how to manage the case and then call the attending for questions about that.
The Betty Shirley Clinic, which is our main psychiatry clinic, is where they will see most of their patients, and that is a typical outpatient psychiatry patient clinic. We see adults, children, and geriatric patients.
Tuscaloosa is a great town. It's really home for us. If you're someone who likes college towns, Tuscaloosa is a wonderful place to live. It's small, friendly, very much a community around the university.
Being based at the University of Alabama is a big benefit. I really enjoy living in a college town. We have fantastic sports here, and I'm a big sports fan, so we go to the basketball games, women and men's, football games, baseball games, softball games. So there's a lot to keep you busy if you like sports. It's less expensive, people are super nice, and it's a really nice place to live.
I think, again, the fact that there's potential for growth and not just being a part of a program that's been there forever, but being something new is another big part of what I've found so far interesting.
It's a great place where you're going to get a lot of different opportunities, a lot of different rotations, and you're going to get a great 4 years at this wonderful college town with so much stuff to do outside of your residency position.